Becerra.
Chairman Wyden, Ranking Member Crapo, and members of the committee, thank you for the invitation. When President Biden took office in January 2021, COVID was ravaging our families and our economy, and Americans were dying at the rate of 2 to 3 9/11s every day. I will repeat that. Every day, we were losing Americans at the rate of 2 to 3 9/11s every day. In January of 2021, the number of Americans with health insurance was, like our jobs and the economy, down and on the canvas. Prescription drug prices were skyrocketing, with patients and their pocketbooks at the mercy of Big Pharma and its profits. Today, 3 years later, nearly 700 million shots of COVID vaccines have gone into the arms of Americans, and we can now manage COVID like the flu. Today, more than 300 million Americans, a record number, can go to the doctor or hospital and not go bankrupt because they have their own health insurance. More than 21 million of those Americans can count on the Affordable Care Act marketplace for their insurance, another record. Today, while Big Pharma is still big, the President's new prescription drug law has brought down the price of insulin to $35 per month for Americans on Medicare. And as we speak, we are negotiating with drug companies to lower the prices of even more prescription drugs, even as they sue us to stop us. The President's budget doubles down on the investments that made the comeback of our jobs, our economy, and our health possible. It lays out a vision for a nation that invests in its most vulnerable, fosters innovation, and protects every American's access to the care she needs. This budget doesn't just strengthen Medicare, it strengthens it beyond our lifetime. This budget continues our shift from a health system that treats illness to one that sustains wellness. All told, the FY 2025 budget proposes $130.7 billion in discretionary and $1.7 trillion in mandatory funding to advance our mission and invest in key priorities. Let me share some of the highlights. The budget provides Medicaid-like coverage to low-income individuals in the outlier states that have not expanded Medicaid under the Affordable Care Act. When that happens, another 1.5 million Americans will have health care coverage and the peace of mind that comes with it. This budget builds on the largest investment in behavioral health in a generation. It bolsters the 988 suicide and crisis lifeline. It gives young people support at home and school. That means boosting our behavioral health workforce with 12,000 new psychiatrists, psychologists, clinical social workers, marriage and family therapists, counselors, and peer support specialists. Across HHS, the budget tackles the maternal health crisis by improving access to pre- and postnatal care, supporting emergency care services, and expanding maternal care in rural and underserved communities. We are making childcare more affordable for working families and more available where families live and work. This budget would provide increased wages for early childhood education workers, and it would fund more than 750,000 slots for children in Head Start. And it funds universal preschool for our nation's 4 million four-year-old children, and eventually include our 3-year-olds as well. Our budget grows and strengthens our cybersecurity initiatives to ensure patient safety and privacy, and to keep our hospitals and providers, especially smaller ones and those in rural communities, running and secure. Finally, this administration has made tremendous strides in preparedness capabilities since the pandemic, and we keep building. This budget invests in countermeasures to combat antimicrobial resistant drugs, to expand our monitoring of supply chains, and to integrate 200 data sources across federal, state, and local governments to improve information sharing. We can't reduce the health and well-being of Americans to a line on a budget spreadsheet, but we can transform the numbers on that balance sheet into investments and services that sustain health and promote wellness for all Americans. President Biden has presented a forward-leaning budget. I look forward to taking your questions.
Thank you, Mr. Secretary.